truly, as Senator Murray said, the 21st Century Cures Act is a world-changing piece of legislation. And it seems rather quiet and unremarkable today, but I actually believe that we're taking a major step toward disease cure and healthcare research that rivals the legislation that actually founded the National Institutes of Health some decades ago. So we're about important business here at Christmas time as we near the end of this lame duck session. Senator Blunt and I, and perhaps other senators, were over in the chamber of the other body last Wednesday afternoon when the House of Representatives passed the 21st Century Cures Act by an overwhelming bipartisan vote of 392 to 26. I appreciated the work that House leaders did from top to bottom and on both sides of the aisle on this important legislation. And of course, I'm always pleased to visit my colleagues over there. A number of our House colleagues were over here last night, Mr. President, when the U.S. Senate invoked cloture on the Cures Act by an overwhelming vote of 85 to 13. And we will get to the vote either this afternoon or early tomorrow, and I have every confidence that there'll be a strong vote on final passage. This 21st Century Cures Act is the product of several years of bipartisan work in both houses. And my friend from Washington State gave a comprehensive overview of the legislation, which is indeed breathtaking. I would like to come behind her and mention what an accomplishment this is in three areas. First, in Alzheimer's research, then secondly, in pediatric research, and finally, in the drug approval process. And I appreciate my friend from Washington and 62 others in agreeing to take this, into this legislation the EUREKA Act, which I was happy to sponsor and which 62 of my colleagues co-sponsored. EUREKA would and will initiate prize competitions in the fight against some of our nation's most terrible diseases, including Alzheimer's. These prizes would pay only for success, and they would complement current funding that is ongoing and will be ongoing according to the legislation. So they'll be over and above what we're already doing for Alzheimer's. And the senator from Washington was correct about how costly Alzheimer's is. It will top $1 trillion in taxpayer costs by the year 2050 unless we get a cure or unless we achieve major goals with regard to stopping Alzheimer's. So it's an expensive disease, the most expensive disease in the history of this country. But also it's terribly expensive in terms of human suffering. And I know many, many Americans, including my family, have been touched in a very terrible and dramatic way by Alzheimer's. So I'm pleased that the EUREKA prizes are part of this legislation. I want to thank everyone who has helped us in this regard, including the advice we got from the X Prize Foundation, from all of the Alzheimer's groups, including the Alzheimer's Association and Us Against Alzheimer's. Thanks also should go to Dr. Francis Collins and the entire team at the National Institutes of Health for making this provision work and for listening to a different idea, the concept of prizes for healthcare research, and giving it an attentive ear and being willing to agree that in addition to the funding, we would attack these diseases with a prize competition. The NIH funding in cures includes additional dollars for the BRAIN initiative. And these EUREKA prizes will ensure our researchers have the tools they need. Now, secondly, another important part of the NIH section of the Cures Act is the National Pediatric Research Network, inspired by the Pediatric Research Improvement Act, that I was happy to co-sponsor with Senator Brown earlier this year. Senator Brown and I have been working together tirelessly to see NIH implement the National Pediatric Research Network, and I'm glad to see that this provision in the bill, very simply, the goal is to expand access to clinical trials and treatments for children, especially those with rare diseases. So that is a second aspect of this Cures bill that I'm so pleased to see the leadership of this committee being attentive to. And then also, thirdly, this bill makes major breakthroughs in the way we approve drugs in this country. And I'm pleased that language from another bill that I co-sponsored, the Patient-Focused Impact Assessment Act, was included in the bill. This section of the Cures bill would ensure that patients understand the way FDA considers the patient experience and the way FDA considers data in the drug approval process. So for patients like those living with Duchenne and their families, for people who are interested in the drug approval process, and for the parents of children, this is really a truly bipartisan achievement. And I'm happy that Senator Murray was here so I could congratulate her in person. Certainly Senator Lamar Alexander, chairman of the Health Committee, deserves high praise from both sides of the aisle for his leadership in this regard, and as well as the bipartisan leadership of the House of Representatives. As we enter this holiday season, patients, advocates, and providers have an extra reason to rejoice as this bill heads to the President's desk.